Current protocols for the management of type 2 diabetes, choosing between SGLT2 inhibitors and GLP-1 receptor agonists based on cardiovascular risk, both sodium glucose cotransporter, 2 SGLT2 inhibitors and glucagon-like peptide. 1. GLP-1 receptor agonists reduce cardiovascular and renal risks in type 2 diabetes. However, their clinical benefits vary depending on the patient's cardiovascular profile. SGLT2 inhibitors demonstrate particular efficacy in reducing the rate of hospitalizations for heart failure and slowing the decline in renal function, making them the drugs of choice for patients with heart failure or chronic kidney disease, regardless of the presence of established cardiovascular disease. In contrast, ARBs demonstrate more pronounced benefits in reducing the risk of atherosclerotic cardiovascular events, such as non-fatal stroke and myocardial infarction, particularly in patients with established atherosclerotic cardiovascular disease or high cardiovascular risk. Therapy selection can be personalized based on clinical characteristics. SGLT2 inhibitors may be preferred in patients with a higher body mass index and less severe kidney impairment, whereas SGLT2 inhibitors are more suitable for individuals with better kidney function and a more severe history of cardiovascular disease. Combination therapy with both classes of drugs may provide additive benefits regarding metabolic, cardiovascular, and renal outcomes, particularly in patients with multiple risk factors, although treatment costs and tolerability should be considered. In general, clinical guidelines recommend prioritizing GLP-1 receptor agonists to reduce the risk of atherosclerotic cardiovascular disease and SGLT2 inhibitors for renal protection and in heart failure, tailoring therapy to the patient's individual risk profile and comorbidities.